Hey guys, I got back from a play date with some of my friends. We were talking about what we eat. Some of my friends are breastfed like me, but some are bottle fed formula. What do you guys think is best?
Hey, Super Baby. The other toys and I hypothesize that breastfeeding reduces the risk of illness more than bottle feeding formula.
That's really interesting. Have you found any data that supports this claim?
A study done by 3 doctors followed 7,062 infants for the first 6 months of their life. The infants were categorized into groups by how much they were breastfed in comparison with other feedings. The doctors found that compared with babies who were not breastfeeding, all breastfeeding infants had lower occurrences of diarrhea, cough, and vomiting. Full breastfeeding infants without siblings had fewer reports of ear infections, colds, and fever. Overall, this study concluded that breastfeeding infants had lower reports of total illness months and of any illness in a month. There were also fewer amounts of sick baby medical visits for full breastfeeding infants.
That seems like great evidence to support your hypothesis. Did you conclude anything else?
We discovered that it is important for babies to be breastfed for at least 6 months after birth because breast milk contains antibodies that enhance babies' immune systems so they will not get colds, strep throats, or ear infections. This is because breast milk has living cells called leukocytes, which help to prevent infection.
Wow, that's amazing. This is a good thing to know because ear infections can really hurt, and if I got sick, I wouldn't be able to play with all of you. Giraffe, where else did you look to find information that was used as a basis for your hypothesis?
I found a study done in Scotland where researchers gathered information on 502,948 babies from the year 1997 to 2009. They were looking at the rate of hospitalization as well as the length of stay at the hospital for babies who were breastfed, formula fed, and fed a combination of both. The results showed that there were a high rate of hospitalization for babies formula fed at 31% than for breastfed babies, which was 21%. They also found that breastfed babies had shorter durations at the hospital stay as well, with the average stay for formula-fed babies being 3.25 days compared to 2.81 days for breastfed babies. Overall, the authors concluded that formula-fed babies were more prone to being hospitalized due to illness than breastfed babies past the age of 6 to 8 weeks. This study gave evidence of benefits of breast milk over formula milk, which supports our hypothesis.
Great research, Giraffe. Monkey, you also said that you did more research on breastfeeding to further support your hypothesis. What did you find?
I looked at a report where 2,602 babies were tested at a hospital in Perth, West Australia, and the researchers compared babies who were just breastfed to those who were partially breastfed to see the effects of each of these feeding methods had on the baby's health in terms of respiratory illness and infection. The researchers found that breastfed babies who received breast milk for more than 6 months after birth and those that were given partial breast milk for a year could possibly have a reduced risk of respiratory infection.
Great job to both of you.
Wait, I did research too. I found a study where researchers looked at salivary cortisol levels in both breastfed babies and formula fed babies. Salivary cortisol levels represent the stress level of the baby. They found that breastfed babies' salivary cortisol levels were 40% higher than in formula fed. This supports the resilience of babies later in their life, and they would not only have a greater physical resilience in relation to sickness, but also a greater psychological resilience.
Wow, you three really did your homework. I'm going to ask my pediatrician and see what her opinion is.
We do know that breast milk offers fantastic protection for a baby's immune system. The immunoglobulins that get transferred from the mother to the baby stay with the baby for the rest of their life. The gut is colonized initially, and the baby is much less likely to get diarrheal infections, to get ear infections, much less likely to have asthma. It's protective against a lot of common illnesses in childhood.
That is great. I am so happy that my mom chose to breastfeed. After hearing all of this research, it is clear to me that breastfeeding has many more benefits to an infant's health than bottle feeding formula. Breastfeeding provides infants with antibodies from their mothers that enhances their immune system, reducing the amount of illnesses an infant contracts. That means less doctors and hospital visits for me. Breast milk also reduces the risk of getting respiratory infections, so I won't have any trouble breathing. Also, drinking breast milk increases stress response, which will make me more resistant. Thank you, everyone, for all of your help. I'll tell my friends all about this.